Number one, of course, is a drug you probably have all heard of called Lipitor. Okay, and this is quite amazing because Lipitor was only marketed in the US probably for no more than 4 or 5 years. And within a very short span of time, it jumped from nowhere all the way to top 10 about 3 years ago, then top 2, and then in the last year or so, it was the #1 medication in the entire United States. Okay. You'll see this drug marketed in a lot of different places. I've seen it on TV, in a lot of journals, magazines. So it's pretty much everywhere. And this drug, as you probably know, is a drug specifically for treating high cholesterol. Okay. Pharmacologically, it's classified as something called the HMG-CoA reductase inhibitor. But really, you're never going to hear anybody referring to this drug by this name because it's too long. But instead, most of the doctors, most of the patients are going to refer to this drug as a statin type of cholesterol drug. And the reason is because if you look at all the other drugs in this class, you have drugs like simvastatin, fluvastatin, pravastatin, which are Zocor, Lescor, and Pravachol. And basically, they all have the statin name in the generic name, and that's why they are all referred to as a statin drugs. So anyways, like I said, at this point, whether the herbs will increase breast cancer or not, there is really mixed evidence, or there's really no evidence that shows one way or the other in most cases. Okay, but if I have to stay away from certain herbs, these would at least be the herbs I would stay away from. Because these, if any herbs, if there are any herbs that may increase the risk of breast cancer, these are more likely than the others to be the ones. Okay. Anyways, overall, as a whole, when you treat menopause patients, I think this is one area where Chinese herbs are going to be more effective and more successful than the drugs, because Premarin is no longer the drug of choice. There's a lot of risk that are associated with it. So for most people, it's just not worth it. Okay, so there are not a lot of other options in Western medicine in terms of treating hot flashes or emotional disturbance. Okay, herbs are not as strong as Premarin per se, but they are strong enough in most cases, and they are generally speaking a lot safer. Okay, so this is one area where a lot of women at this point in time will want second opinion as to what's the best for them, and a lot of time this is a great time to intervene and to treat these patients.